In the first part of this demonstration, I was able to show you how to develop a simple mathematical model to predict the growth of the epidemic. I was able to show you that the rate of the spread or the rate of the increase of the infection is given by the product of the number of active cases, a spread factor, and the probability of getting somebody who is not infected. In mathematical terms, this can be expressed as dy dt is equals to y of t, that is the total number of cases reported to date, minus the total number of cases that were reported 21 days ago, times the spread factor, times the probability of getting somebody who is not infected, which is 1, minus the total number of cases reported to date divided by the population. Now I'm going to show you how to work out the spread factor so that you can determine the increase from one day to the next. We have seen that the spread factor is given by 1 over t plus 0.1004, t being the number of days since the spread started. However, this function assumes that time is measured continuously. But in reality, we know that we work out the number of cases from one day to the next. Therefore, those who are familiar with mathematics know that this function cannot be applied directly as it is. So what we need to do is to carry out what we call an integration from one day to the next. And this actually modifies the spread factor and will give you this kind of an expression when you use n approximating points to work out the spread factor from one day to the next. When t is very large, this expression becomes simpler and it becomes what we have down here. So we'll see how you can simply apply this using Excel worksheets to work out the increase from one day to the next. Now, because we understand the do-nothing model and the components that make up this model, what we are going to do is to tabulate the data for these components and use it to work out the cases predicted by our model for the 4 countries and for the first 45 days. The first component that we tabulate is the day of the spread, which we depict as time t. The next component is the probability of getting somebody who is not infected, which you said is equal to 1 minus the number of cases reported to date divided by the total population. The other component is a spread factor. Then the number of active cases which we said is equal to the number of cases reported today minus the number of cases that were reported 21 days ago. Next is the daily increase in the number of cases, which is given by the product of these 3 components. To get the total number of cases that are predicted by a model, what we need to do is to sum up the daily increase from one day to the next. For the day of the spread, we start with day number 1 and continue all the way to day 45. For the probability of getting somebody who is not infected, let's start with the Italian case. So this will be equal to 1 minus the total number of cases divided by the total population, which for Italy is around 60 million. We repeat this for the next 44 days so that we work it out for all the 45 days. For now, you can see the probability is 1 because we have not filled anything in this column of the total number of cases. As for the spread factor, we saw the expression that we need to use to calculate it, and we just use it here directly. and continue doing the same until we cover the whole of the 45 days. The active number of cases for the first day will be equal to the number of cases reported on that day, and this will be the same for the next 20 days up to day number 21. But for the 22nd day, this will be equal to the number of cases reported on that day minus the number of cases reported on the first day, which was 21 days ago. And this will be repeated all the way up to the 45th day. The daily increase is a product of these three components: the probability times the spread factor times the active number of cases. And actually we can round this to the nearest whole number. So we repeat the same so that we cover the whole of the 45 days. As for the daily increase, we take the number of cases in the first day to be 43, as had been predicted by a model. And for the second day, the cases will be what was there in the previous day, plus what was predicted on the daily increase. In this case, it was 52. And we'll continue doing the same until the 45th day. So now you can see that we have the total number of cases as predicted by our model. I'm now going to place the predicted data for Italy in this column and call it the Italy model. I'm now going to place the date and the data that was reported alongside this Italy model data. We are now able to see this data from the date, the cases that are reported, and the cases that are predicted by a model. This way, we can plot a graph and be able to compare the trends between the do nothing model and also the number of cases that were reported. The same exercise has now been repeated for the other three countries. So we have now tabulated the reported cases in Spain versus the cases that are being predicted by a model, the reported cases in France and the ones being predicted by a model, and the same for UK. So now we have the combined data for the four countries, and we can plot it and see what we can infer from the graphs. So these are the curves that are obtained when the data is plotted. And as you can see, we have 8 lines, 2 for each country, 1 for the do nothing case, like the case for Italy, it's a brown curve, and the other one for the cases that were actually reported. In case for Italy, we can see that the cases that were reported were tracking the do nothing curve up and until around 23rd or 24th March. This means that at this time, the measures Italy had taken were beginning to have effect, and you can see the number of cases were reported were becoming lower. For the other 3 countries, up to 30th of March, the reported cases were still tracking the do nothing curve. This means that if any measures had been taken, they had not started to take effect. We are later going to see how the measures are brought in to modify the do nothing curve, and so that we are able to track the cases as they are being reported. We are now going to leave this at this point, and what we'll be looking at next is how the do nothing case builds up after a long time. That is, if you don't take any measures, then what really happens? Now we have seen how the do nothing model is worked out. We are going to do the same. This time we are going to apply for the Kenyan case, where on the first day, that was on 12th of March, the first case was reported. Now the probability of the getting somebody who is not infected is going to be 1 minus the number of cases reported divided by the population of Kenya, which is 48,700,000. I've tabulated this for 365 days, and we'll be able to see what would happen if no measures were being taken. In other words, how would this build-up look like if the government and the population were not taking any measures? I've plotted 3 graphs from the data. One is the total number of cases for the 365 days. The second is the number of active cases, that is the people who are infected at any one given time. And the other one is a daily increase in the number of cases. If no measures are taken, you can see that from day 96, the cases would rise rapidly. And at day around 180, that is after about 6 months, virtually the whole of population will have been infected. That is, we'll have about 42 million people who would have actually been infected. The number of active cases is the number of people who are infected on any given day. You can see again that this number would start peaking from 96 days, and then it will rise rapidly to a maximum of 21 million on day 155. Then they will start dying down, and after 7 months, that is day 210, the number of active cases will have gone almost back to 0. So you can see that the corona wave actually would take about 7 months to pass through and go back to 0. That is if no measures are actually taken. We'll see that if we take any measures, we can reduce this curve, and it is possible for us to kill the curve completely in a very short time. The daily increase depicts the logarithmic aspect of the active cases. You find that because the numbers are too high for you to have a good view of what is happening, it's easier to plot the daily increase versus the number of the day. We have seen that the growth of the epidemic in the do-nothing case happens very rapidly. It builds up quite quickly. In a few months, it has peaked, and we have very high numbers, up to 20 million. And then it dies out equally rapidly within another few months. That is why this disease is a very big problem. Because you can see that at one point, you're going to have so many people infected at the same time. 5 million people, 10 million people, all infected at the same time. And this is a big problem because even to manage flu symptoms on their own is going to be a huge task because so many people will be infected at the same time. We also know that when so many people are infected at the same time, a proportionally high number of people will require to be hospitalized. Some will require bed spaces. Others will require ICU facilities. Others will even die and they will require to be buried. So because the numbers are very high, we find that we will start running out of bed spaces, we start running out of ICU facilities, and we even run out of places to bury them. You saw what happened in New York recently. So we cannot leave this disease to go unchecked. We must take measures to ensure that the numbers do not build up to be so high at the same time. We have seen some of the measures that can be taken. One is, for example, to call a lockdown. And when a lockdown is called, it minimizes the interactions between people and reduces the spread factor. The other measure is to put on a face mask. And when you put on a face mask, it minimizes the chance of one person infecting another person. So you can see that all these measures are actually social measures that require a bit of change in our behavior. I'm now going to introduce a social factor, SF of t, that modifies the spread depending on how close the population is from time to time. So when a lockdown is called, people return to their families. Before, they were interacting with other people at the place of work or wherever they could have been staying. But this time, they just come back and they're restricted to staying within their family units. What you find is that that may increase the number of cases initially because people have come back from the different groups they were with and now they are with the families. So those who are infected can actually spread the disease among their family members. But as time goes on, there's no more interaction because it's a lockdown. And what happens is that the social factor becomes smaller. So initially, when the lockdown is called, the social factor can be slightly greater than 1. But after some time, then the social factor goes to below 1. We saw the infamous case when Nairobi was actually closed. People tried to get out of Nairobi in large numbers, and they were blocked at the exit of the metropolitan boundary. That congestion that came could cause spike in cases. So what it means is that the measures, when a lockdown is called, the measures for implementing the lockdown can actually lead to an initial spread, an initial spike in the spread. That can modify the social factor, which can go up. So what we are going to do is we are going to apply the modified equation in our modeling, and you see how the growth curves are affected. We have seen the build-up of the infections when no measures are taken or the do nothing model, where they start peaking at around day 96 and they build up very rapidly until day 155 when they peak, and you can see we have a very large peak of almost 21 million. And then they die out quite rapidly, and around day 210 they go back almost to 0. So what I've done is, like I explained earlier, is to introduce a social factor which modifies the spread factor depending on how the measures are enforced. We know that if people keep social distancing, the rate of the spread will become smaller. So we can use this social factor to modify the spread factor, and we will work the daily number of cases by taking the product of the 4 components now: the social factor, the probability, the spread factor, and the active cases. For the do nothing case that we have looked at, we can consider the social factor to be equal to 1 because we only multiplied these 3 components. But subsequently, we'll be able to see how the curve is affected when we introduce different values for the social factor. For example, if we put the social factor to be equal to 0.9, you can see that the curve broadens and it peaks later than the one for the do nothing case. The peak here is about 17 million. If we increase the social distancing and reduce the probability of infection, you can see it goes down at 0.8. We have 13 million at the peak, and it's broader, speaking around August. I've made the plot of the COVID curves for the different social factors. And for the do nothing case, you can see that we have the highest peak at 21 million. And it comes even quite soon compared to the others. You can see at 0.9, the peak is 17 million. And the trend continues that way until at 0.4, you can see that the wave is completely dead. If we decrease the social factor to 0.4, now you can see that the wave actually dies down. It never grows, it actually dies down. So what we are seeing is that it's possible for us to kill this wave. But what we need to do is to ensure strict measures, social distancing, so that we can lower the spread factor, because now the spread factor in this case will be like this times 0.4. So, but you can see that at 0.5, the cases are still building up. This tells us that there's a social factor value between 0.5 and 0.4, which marks the borderline between when the cases are building up and when the cases are going to die. I was able to determine the borderline value to be 0.453. So at 0.4, you saw that actually the cases are dying down. At 0.5, they're still moving up. But at 0.453, that's a border value. So it should be our target so that we can actually kill the wave. So once we attain that and below, then we know that the wave is actually going to die out. This is a plot of Italy's do nothing curve up to day 59, which is 13th April. So we can see that the do nothing curve, the one in blue, is rising quite rapidly compared to the reported cases. We saw this trend started a while ago, and we say it is because the measures Italy was taking must have begun taking effect. The do nothing curve, the one in blue, rises quite rapidly compared to the number of cases that are reported from around day number 37. So what we are going to do is to see how we can track the cases by changing the social factor. Now this curve, we have said the do nothing curve is represented by the social factor of SF is equals to 1. If, for example, we change the social factor to 0.7 on day 37, then you see how the curve changes. So you can see it's beginning to track from day 37 all the way up to day 43, around day 43 here. So you can see now the curve is being tracked by 0.7 social factor. The measures that were being taken had an effect equivalent to a social factor of 0.7. We can see again at day number 43, the do nothing cases are now rising more rapidly compared to the reported cases. So for us to track this, then we can reduce the social factor on day number 43. Let's give it a value of 0.37. Again, you can see that the do nothing cases are now tracking the cases reported more closely, and this is happening well up to day around number 51. So if you put the social factor to 0.3 on day number 51, then you can see that now we have tracked completely the number of cases. Why this is important is because we want to see that to determine the social factor on day 59, and we will be able to tell whether the wave is actually going to die out or not die out, because we saw that if the social factor value is less than 0.453, then the wave is actually going to die out. I tracked more closely the predicted cases and the cases that are reported by changing the social factor. You can see clearly that the brown wave is actually falling on the blue wave, so that we don't even see the blue wave anywhere on the curve. And I'm going to show you the values that are obtained for the social factor to track the cases in Italy. Now you can see that the daily trend, when this case is tracked like this, will give us a peak between March 21 and March 27, and you can see that the wave dies out. Now we understand this because we have seen the social factor on day 59 is 0.3, so we expect that the wave is actually going to die out. These are the social factor values that are used to track that wave, and you can see that on day 59 the social factor stood at 0.3, and clearly because it's below the threshold value of 0.453, now we know that the wave is actually going to die out. I have similarly tracked the cases that were being reported in Spain, and you can see that the predicted cases now are completely tracking the reported cases. The social factor values that I used are shown here. You can see that at some points there was a spike, and like I had explained earlier, this could be around the time the lockdown was being called, because we said the measures for calling the lockdown also sometimes may lead to a spike. You can see that as per yesterday, the social factor was down to 0.25, and this tells us that the wave is going to collapse because the value is less than 0.453, the threshold value, and this means that the peak of the Spanish cases is going to fall between 10th and 15th April.
A similar exercise of tracking the reported cases with the predicted cases was repeated for France. And you can see the tracking has been done completely so that the blue wave is not visible. On the 59th day, that was 13th April, the social factor is 0.25, which is well below the threshold value, which means that the measures being taken are adequate to kill the wave. And you can see that the peak of the number of active cases is going to happen between 15th and 20th April. Thereafter, the curve will start dying down. You can see clearly the downward trend of the social factor if you just ignore the one-off spikes, and this tells you clearly that the measures taken were having effect. Finally, the same exercise was repeated for the cases reported in the UK, and you can see that the reported cases were tracked completely with the predicted cases. And although we are seeing a downward trend in the social factor S, the social factor on the 13th of April was 0.57, which is well above the threshold value of 0.453. This means that the measures taken by the UK have not yet overcome the corona wave. So it's still an upward trend, and it could rise if the same conditions are maintained up to 3.5 million cases, peaking at the 11th of September.
I have to caution that the model that we have developed here is a very simple model. It's based on very basic data that is collected from websites. So I cannot guarantee any accuracy of prediction. So if you are going to use it in a very cautious way. However, the whole intention is just to show you how the modeling can be done and how inferences can be made from the modeling. The coronavirus disease, COVID-19, or what Donald J. Trump calls the Chinese virus, is a very serious problem. Initially, we had been made to believe it was like a simple cold, you'd have mild symptoms and get away with it. But now we know that it is spreading very quickly and is spreading all over the world. It is moving like a hurricane, hitting one country after the next. But we have seen from the modeling that even if we do nothing, it will pass through in a year's time. Unfortunately, if we do nothing, it will have crushed so many people. Some of them who are so dear to our lives. So we must do something. We must do something to kill this wave. We know what we must do because we have been told what to do. Keep social distancing, wear face mask, wash your hands, sanitize your doors, sanitize everything that you're going to be touching. We have been told what to do. And if you do this, then you'll be able to bring down this wave. We also know that times like this bring the best out of human beings. We know great inventions were done in times of crisis, in times of war. I believe when this crisis has lifted, we'll come up with some good ways of doing things, which will leave us stronger. So we cannot wait for the new dawn, what I'm sure many people are going to call post-corona era. Because we'll have become renewed ourselves. And we have learned how to do many more things that previously we didn't know how to do. So I thank you so much for your patience, because I know this production was very long. But I hope it has taught you something. And whatever you have learned, also take time to teach somebody else. Thank you very much.